How's it going, guys? Past level question of hepatobiliary. Step 1, internal medicine surgery, 2 CK. 59-year-old woman, 6-month history, intermittent abdominal pain, yellow eyes. She smoked a pack of cigarettes daily, 40 years. Drinks whiskey periodically. Vitals are temperature 100 Fahrenheit, heart rate 72, respiratory rate 16, blood pressure 130 on 90. Sudan black stain of the stool is negative. This is for fat. So oil, red O, and Sudan black are for fat staining. Laboratory studies show elevated total bilirubin at 3 should be 1. Alkaline phosphatase elevated 300, should be 50 to 150, and then our amylase is elevated. So I didn't give you the normal ranges here for bilirubin ALP because you can probably infer that they're high because they're scleral icterus anyway, and none of our answers would reflect an unconjugated hyperbilirubinemia. Okay, so scleral icterus with answers that could only be obstructive jaundice tells us that we're going to have a high ALP. This is secreted by bile duct epithelium. And then you'd have a high conjugated fraction here. So which of the following most likely explanation for these? And I've seen NBME do that. They don't have to separate it out direct, indirect. Which of the following most likely explanation for these findings? Choice A, cholestasis, wrong fucking answer. You know it's wrong because 29 out of 30 times, they're not going to give you an increased bilirubin and ALP. Okay, cholecystitis is inflammation of the gallbladder. Okay, and with isolated inflammation of the gallbladder, we don't have any type of biliary obstruction. So we wouldn't have bilirubin or ALP increased. Now, cholecystitis is almost always due to stones. Of course, there can be other causes, iatrogenic intervention, etc., but it's almost always due to obstruction due to a stone, okay, causing a bacterial infection. So in the very rare event, there's 1-2 CK NBME question. We're talking like 1 out of 30 across all NBMEs for steps 1 and 2 combined. There is an increased bilirubin and ALP, but it's in the setting of also having a stone in the biliary tree. Wrong fucking answer. Choice B, cholelithiasis. Correct answer. So the giveaway is that we have a high amylase here. So this is what's called gallstone pancreatitis. Now, cholelithiasis means a stone not in the gallbladder, but in the biliary tree. And there's 2 different types for USMLE. The stone can be higher up in the biliary tree where it does not block off the hepatopancreatic ampulla, and our amylase/lipase would be normal. So if that were the case, you'd have to say, well, we have obstructive jaundice and amylase lipase are normal. Could this be cholelithiasis or could this be head of pancreas cancer? They're both important causes of obstructive jaundice with a normal amylase lipase. Now, head of pancreas cancer, I gave you a smoker here, okay, drinks periodically, but we know it's not head of pancreas cancer because they're not going to give you elevated pancreatic enzymes, pancreatic cancer. Students frequently mess that up, okay? So pancreatic enzymes are not elevated with pancreatic cancer. That's how we eliminate choice D here. And if they want cholelithiasis, they might tell you where it's higher up, not causing gallstone pancreatitis. They might tell you the patient has history of colicky abdominal pain, indicating history of cholelithiasis, stones in the gallbladder. And then one finally descends into the biliary tree. You say, well, that's a relevant history for stones. So it sounds like cholelithiasis overhead of pancreas cancer. Or they can tell you a patient had a cholecystectomy within the past 2 months. And they might say intraoperative cholangiography was not performed, which means there may have been a retained stone within the cystic duct draining the gallbladder that's now descended into the common bile duct, causing cholelithiasis. Now, if they tell you the patient has a remote history of cholecystectomy, and they'll do this, they'll say the patient's 82 years old and had a cholecystectomy at the age of 58 years. And you know it's impossible for it to be cholelithiasis because the gallbladder was taken out 24 years ago. You need a gallbladder to produce stones for cholelithiasis. That would be head of pancreas cancer impinging on the common bile duct. Okay, it's called Courvoisier's sign, where you have painless palpable gallbladder in an afebrile patient with jaundice. Okay, that's Courvoisier sign. That's head of pancreas adenocarcinoma. So this is gallstone pancreatitis, the second type, where the stone has descended distally enough in the biliary tree to cut off the hepatopancreatic ampulla. So those enzymes, proteases, lipases from the pancreas are going to back up to the pancreas, causing enzymatic fat necrosis. Okay, so that's what we have here. So they're going to do ultrasound followed by CT, followed by ERCP for 2CK. And there's a variety of questions where they may or may not list those different modalities. So you have to know that order. Okay, so real quick, let's just hop through the others. Cholelithiasis, wrong fucking answer. This is just stones in the gallbladder. Fat 40s, female, fertile for cholesterol stones. For pigment stones, calcium bilirubinate stones could be things with RBC turnover like hereditary spherocytosis, sickle cell. But this is not similar to cholecystitis. Isolated cholelithiasis, stones in the gallbladder, you're not going to have an increased bilirubin or ALP. They have to descend into the common bile duct for you to have obstructive jaundice. Wrong fucking answer. Choice D, had a pancreas adenocarcinoma. Wrong fucking answer, as I already said. You would have a normal amylase / lipase. Very important. Okay, and once again, it is, however, an important cause of obstructive jaundice otherwise, with Courvoisier's sign, as I said. So painless, palpable gallbladder in an afebrile patient with jaundice. Wrong fucking answer. Choice C, chronic pancreatitis. Wrong fucking answer. So you're going to have normal pancreatic enzymes in chronic pancreatitis. I want you to think of this as cirrhosis, but of the pancreas. So they'll give you an alcoholic who has steatorrhea. Okay, I gave you negative fat in the stool, so you know it's the wrong answer. Okay, let alone the fact that our pancreatic enzymes are elevated here. And you wouldn't have increased bilirubin or ALP, so the whole thing is wrong. They'll just say 49-year-old dude with chronic alcoholism has fat and even protein in the stool. Pancreatic enzyme is normal. That's it. That's chronic pancreatitis. It's not acute pancreatitis. Wrong fucking answer. You know the deal. I'm to make more content with myself, subscribe my channel. Appreciate your time. That's it.